Hello physios, welcome to the New Age Classroom, Physiotherapy Simplified. In the previous video, we talked about force, gravity, and Newton's laws. Let's continue talking about other important physical laws and principles and their clinical applications. Today, let's talk about stability, fixation, and levers. We will also learn about their clinical applications. So, before discussing stability, let's define some basic terminologies, i.e., line of gravity, and base of support. These basic concepts should be considered thoroughly when dealing with a patient whose balance is affected, for example, hemiplegia cases. To understand line of gravity, imagine a line that runs vertically through the Earth's center of mass. This line is perpendicular to the Earth's surface. This is line of gravity. Now, why is this line important for you as a physiotherapist? Because we use this line as a reference when discussing and assessing posture. It determines stability of an object. You see, if this line of gravity falls in base of support, the object will remain stable. If not, as shown in the picture, the person might fall. Now, let's discuss our second terminology, base of support. The area between objects' point of contact, i.e., our feet and earth, is called base of support. Now, the thumb rule to remember here will be larger BOS means better stability. How is that clinically important? Well, during rehabilitation of balance, in the initial stage, we need to teach patients to stand with wide base of support so that log falls into base of support and person becomes more stable. You may add activities like reaching out to take a ball from therapist's hand. Keep in mind that in hemiplegia or other imbalance cases, interventions are given based on type of balance affected: static, dynamic, anticipatory, or reactive. We'll discuss these balance types, assessment of each, and intervention in another video in detail. Now that you know what line of gravity and base of support are, let's get back to stability. Now, as we discussed earlier, stability can only be maintained if line of gravity is in base of support and base of support is wide enough. Most of us make unconscious adjustments while we ride in a bus or train to balance ourselves when there is sudden jerk or brake is applied. We discussed how you can improve clients' stability, but how can these principles help a therapist? In therapeutic exercise, the shape and position of your base of support determine the ease with which you can provide manual resistance to a patient. For example, it is easier for you to provide manual resistance to a biceps curl while facing a seated patient if you position your feet in a forward, backward stance rather than a side-by-side stance. On the other hand, you can resist shoulder flexion of a seated patient if you position feet in side-by-side stance. In simple words, fixation is restricting or preventing motion of a segment. But why is fixation clinically important? One advantage of using fixation is to facilitate active muscle contraction, to prevent substitution by surrounding muscles, and fixation techniques can also be used to strengthen muscles in early stages of rehab. If you fix a segment, distal or proximal, you can achieve active contraction of the desired muscle. Let's take the biceps curl example. Fix patient's upper arm by wrapping your hand around it. This will facilitate biceps active contraction. Another advantage of using fixation technique is to prevent substitution by surrounding muscles that you do not intend to strengthen. For example, in the case of shoulder flexion earlier, your patient might substitute it by shrugging or elevating shoulder and using upper trapezius and not anterior deltoid. Lastly, using a muscle as a stabilizer to fixate a body segment can be one way of strengthening it, especially in the early stages of a therapeutic exercise program when it lacks sufficient strength to perform movement. Stabilizer muscles work isometrically to secure a segment, so they exert force without movement. For example, if injured abdominal muscles are too weak or painful to perform an abdominal curl, they may be able to work during a straight leg raise. The abdominals exert force to fixate the trunk during the it pulls the limb. As quadriceps action is knee extension, it holds the limb, thus becoming resistance force. A third-class lever has the force between the fulcrum and the resistance. This is an inefficient lever system for force development, since the force arm is always shorter than the resistance arm. More force is always required to move the resistance. However, an advantage is that greater range of motion occurs with this lever than it does with second-class levers. Another advantage of this lever system is that because of this greater range of motion, speed of movement is produced. The elbow is an example of this class of lever. The biceps tendon inserts on the forearm between the elbow joint and the center of mass of the forearm. This type of lever occurs in most open chain motions of the extremities. This means to say that the muscle must be performing a shortening contraction, also known as a concentric contraction. Limitations to analysis of forces by lever systems. Movements of human segments are not simply produced by muscles and external forces. They result both from additional internal forces and from the vertical and horizontal forces produced by muscles and external forces that are often ignored in a simple lever approach. If you have learned any concept from this video, make sure to like and subscribe. Don't forget to press the bell icon so that you don't miss any notification.